My name is Anant Madabhushi and I'm a professor of biomedical engineering at Emory University and Georgia Tech. I'm also a proud research career scientist with the Veterans Affairs Medical Center. I grew up in India. I was born in the city of Chennai in southern India, but I grew up in what is now called Mumbai. But when I grew up in that city of about over 20 million people, it was called Bombay. And so I like to say that I'm a Bombay wala at heart, or somebody from Bombay. In a past life, I actually have a diploma from the Trinity College of London in speech and drama. So I actually trained in speech and drama. My wife and I have one son that we spend a lot of time with, our 13-year-old boy, Madabhushi. I got my undergraduate degree in biomedical engineering in India. While I was doing my undergraduate degree in biomedical engineering, I also happened to face some personal tragedy. An aunt of mine, a very dear aunt of mine, actually lost her life due to cancer, breast cancer in particular. Looking back, I thought of it as a responsibility to use my training to do something about cancer and try to have an impact on people's lives, particularly when it came to health and medicine. That brought me to the University of Texas, Austin in 1998, where I got my master's degree in biomedical engineering. At the University of Texas, Austin, realized that I wanted to continue on with this training. Was fortunate to get a position in bioengineering for a PhD program at the University of Pennsylvania, where I went and started my training in biomedical engineering. And there, I guess, was my second inflection point, because I had the good fortune of meeting a couple of pathologists at the University of Pennsylvania who introduced me to this area of digital pathology. I started to work in that space. I was fortunate to get a faculty position at Rutgers University in 2004. I'm really excited about being here at Emory and continuing to innovate on these technologies, and then working with Emory Healthcare to be able to deploy these technologies within the clinical workflow so we can start to bring these innovations to patients in a very direct manner. We published a paper in the Lancet Digital Health where we showed, in the context of stage 0 breast cancer, the ability to use AI to identify which patients were going to benefit from radiation therapy and which patients could safely avoid radiation therapy. I do think that we need to acknowledge that technology is going to have an impact. And it means that radiologists and pathologists are going to fundamentally have to rethink how they practice and how they render diagnoses in light of the fact that they will have these very powerful technologies. I don't think it's going to put them out of business, but I think that they are going to have to learn how to use the new stethoscope, if you will.
Hi, I'm Anant Madabhushi. I'm a father, a husband, an aspiring thespian, and I'm an Emory researcher.